Dr. Harris.
Thank you, Senator Blumenthal, Chairman Rockefeller, and members of the committee for inviting me to participate in this important hearing on energy drinks and youth. My name is Dr. Jennifer Harris, and I am Senior Research Scientist and Director of Marketing Initiatives at the Rudd Center for Food Policy and Obesity at Yale University. I've been studying food marketing to children and teens for the past 10 years, and I also have an MBA and 20 years of experience as a marketing executive and consultant. Today, I will describe how energy drink companies reach and target teens, why beverage industry marketing guidelines do not address public health concerns, and how companies could protect minors from the harm caused by their products. I would also like to refer you to my extensive written testimony. In 2010, we began to study youth-targeted marketing of soda, fruit drinks, and other sugary drinks. But what we learned about energy drinks stunned us. Energy drink brands such as 5-Hour Energy Shots and Red Bull spend more on advertising than any other category of sugary drinks except soda. And their TV ads often appear on teen-targeted networks like MTV and Adult Swim. In fact, teens see more energy drink ads than adults do on TV. All brands are active in social media that teens share virally with their friends, including Facebook, Twitter, and YouTube. Red Bull and Monster Energy are the number 5 and the number 12 most popular brands on Facebook. Energy drink brands often promote teen athletes and musicians and sponsor local events where they provide free samples, including to minors. And most energy drinks are sold in convenience stores where special displays encourage impulse purchases and minors can easily buy them without parents' consent. We recently updated our marketing analysis and found that these practices continue unabated and have become worse. New products are being advertised. Several brands doubled their advertising spending in 2 years, and social media fans increased by 2 to 10 times. And this marketing is very effective. While sales of most other beverage categories have declined, energy drink sales increased by 19% in 2012, reaching $8 billion. You've heard that pediatricians are concerned, and so are parents. 3/4 of parents agree that energy drinks should not be marketed or sold to teens under 18. The American Beverage Association and energy drink manufacturers have responded to these concerns. Today, you'll probably hear from members of the panel that caffeine is safe for all ages and that manufacturers comply with ABA guidelines for responsible labeling and marketing of energy drinks. But many energy drink manufacturers do not belong to the ABA, and not all members comply with these guidelines. Further, the FDA has not determined that the concentration of caffeine and the other stimulants in most energy drinks and shots are safe for the food supply. You'll probably also hear that these companies do not market their products to children. But the only marketing the ABA guidelines specifically prohibit is advertising on children's television programs like Nickelodeon and marketing in elementary schools. The policy does not address advertising to children 12 years and older or most common types of energy drink marketing, including social media and sponsorships. The ABA also suggests that energy drinks not be marketed as sports drinks, but companies continue to sponsor sporting events and high school athletics, hire athletes as brand ambassadors, and explicitly encourage use during physical activity. Clearly, more needs to be done to protect teens. At a minimum, energy drink manufacturers should not advertise in media that are more likely to be seen by teens than by adults, and they should establish age requirements to access digital content whenever possible. They should not engage in marketing, including YouTube videos and smartphone apps, which disproportionately appeal to teens. They should not distribute free samples to minors, and they should comply with their own guidelines to not market energy drinks as sports drinks. But teens represent a significant growth opportunity for energy drink companies. Teens are highly vulnerable to marketing influence, especially when it exploits their peer relationships and their desire to appear cool, daring, and grown-up, making them an easy target. If energy drink manufacturers continue to evade the issue of marketing to teens, the FDA, the FTC, policymakers, and attorneys general have the authority to establish and enforce restrictions on energy drink ingredients, labeling, retail placement, and sales to minors. Such regulations would be widely supported by parents, the medical community, and others who advocate for children's health. Thank you, and I look forward to answering your questions.
Dr. Harris.
I'd just like to make a few comments on some of the discussion about marketing. One is that if you take Marketing 101, you'll learn that marketing is aspirational. So if you're showing an 18-year-old in an ad, you're appealing to a 15 or 16-year-old who wants to be grown up. And so I think that that's one thing to recognize, that if they're including 16-year-olds in their ads, they really are appealing to younger kids. Another thing is that we've heard a lot about, well, they can't control who sees their marketing. Well, that simply isn't true. For example, Monster's website, it over-indexes for teens. What that means is that teens are more likely to visit that website than the population in general. So it is appealing to teens, and we can see that with the data that I'm sure they also have available. I would also like to say that there are other ways to not market to teens. For example, Facebook, if you could block anyone under 18 being able to access your Facebook pages. That's what alcohol companies do. That is even what Captain Crunch does, and it says it doesn't market to adults. So it's definitely possible. And the last thing I'd like to say is we haven't talked at all about mobile marketing, but that is where marketing is going in the future. So not only will kids be able to access this marketing on the internet, they'll be able to access it on their phone. The company will be able to know that the child is going into a convenience store, and they can send them a message about an energy drink, and that just should not be allowed. And the companies can stop it if they would want to. Thank you.
Thank you very much. I apologize.
And I think it's important that we just divide this question between that which has obviously included in the product the electrolytes that high school athletic associations would support, and those which are
Senator,
caffeine and
we
give that
make energy
shorter-term
drinks.
boost, but don't have that kind of ingredient that is preferred. So I think we have to divide the question, and I would give each of you a chance in writing back to the committee to tell us if you would divide that question between the two kinds of drinks or multiple kinds of drinks that you might be marketing. And I'll come back to you, Dr. Harris, so that you can make your comment on the issue of what it is that we should be concerned about in terms of these products.
Well, my issue is with the marketing, that all of the associations with sports that we've seen today in the marketing does imply that these products are good and enhance sports performance. So I'm just trying to understand what the ABA commitment is to not market these drinks as sports drinks, what that means.
Okay. Well, why don't you just pose the question to them, ask them what it is, what is your concern? Why don't you lay out what it is that you are concerned that they may not be pledging to do that you would like them to do?
All right. Well, the evidence is that energy drinks should not be consumed as part of sports, and that they become more dangerous when that happens. And all of the sports sponsorships that these companies promote, in my mind, seem to be promoting these drinks as appropriate for sports. So I just want to understand that more.